Today in class, we're going to cover 9.PCH.1.4 content, and this content is about chronic diseases and how they can lead to death, and how they are increased, or risk factors are increased when we don't exercise regularly. We have poor nutrition, to use tobacco, and even excessive alcohol consumption increases your risk for a chronic disease. So a lot of things, depending on our chronic diseases, our choices can, whether we increase our chances of getting a chronic disease, or how much we can decrease our risk of having a chronic disease. So the first thing I'm going to go over is a chronic disease PowerPoint with you guys, and it's going to just touch on several different types of chronic diseases. So the first type of chronic disease we're going to go over is known as cardiovascular disease, and the simple thing is, what is CVD? Because cardiovascular disease is abbreviated as CVD, and it is a disease that affects the heart and the blood vessels. And two major types of CVD are both hypertension, which is high blood pressure, and atherosclerosis. And of course, hypertension, like I said, is known as high blood pressure, and it can damage your blood vessels and your heart, and it's most common in people over 35. To prevent hypertension, you would want to eat healthy, exercise regularly, and manage your weight. Atherosclerosis is a disease where the accumulation of plaque against the artery walls, and of course this is typically caused by unhealthy food choices that are very high in saturated fat and cholesterol. And of course, if the plaque builds up and hardens the walls of your arteries, you are at risk for heart attack and stroke. Factors for CVD, behavioral factors. So these are things that you do with the way that you act. Things like smoking, a poor diet, lack of physical activity, alcohol abuse, obesity, and poor stress management. Environmental factors could be like stress from work, stress from daily life, of course, can increase for cardiovascular disease. Next, we're going to talk about is cancer. And of course, cancer is simply the uncontrollable growth of abnormal cells. And a tumor is a type of cancer, of course, and it may have an abnormal mass of tissue that has no natural role in the body. But here's the thing, tumors are not always cancerous. They can be benign, which is non-cancerous, or they can be malignant, which is cancerous. Sometimes benign ones cause no harm to your body other than just maybe needing to be removed. And then, of course, no treatment would be involved because it is benign, where a malignant is cancerous. They're going to remove that tumor, and sometimes chemotherapy, radiation, and other avenues of treatment would be needed. Skin cancer, of course, is also known as a carcinoma, and that is one of the very most common forms of cancer. And symptoms would be changes in a mole, freckle in your skin, a freckle, or changes in a sore that won't heal, and it can be detected by a physical exam, and it's removed by a biopsy. Lung cancer is also classified as carcinoma. There are no immediate symptoms, but over time, someone develops a severe cough, a shortness of breath, wheezing, coughing up blood, and very hoarseness that really doesn't go away. The way to detect lung cancer is through a chest x-ray. Factors that contribute to getting skin cancer and would be exposure to the sun or radiation, not using sunscreen, proper clothing to shade, or like an umbrella, so constantly like getting sunburnt, even use of tanning beds. Environmental factors for skin cancer would be like a depletion of the ozone, where we're not taking care of the earth and the ozone is depleted, lack of shade, and even if you have an occupation that requires you to work outside. Behavioral factors for lung would be, of course, like smoking and air pollution. The environmental factors for lungs would be exposure to radon, which is radioactive gas, and like asbestos, especially if you work in an environment where you would be exposed to asbestos. Next, we're going to talk about osteoporosis. And osteoporosis is a condition where there's a progressive loss of bone tissue. As you can see this picture right here, a healthy bone is very light and spongy. This osteoporosis bone is very dark and very spacey because it's brittle. to prevent and detect it, of course, unfortunately, bone tissue is a natural part, loss can be a natural part of aging. So the thing you want to do is practice even during your teen years to reduce your osteoporosis is begin doing weight bearing and muscle strengthening exercises so that later down the road you don't have this issue. Of course, it can only be detected by bone scan, and an x-ray is the most to measure the bone density. Behavioral factors to osteoporosis, of course, once again, lack of physical activity, lack of calcium and vitamin D in your diet. There really are no environmental factors because the environment's not going to affect how your bone tissue is. Next, we're going to talk about bronchitis. And bronchitis is the inflammation of the bronchi caused by infection or exposure to irritants like tobacco smoke or even air pollution. And it causes the bronchi to produce way too much mucus, which blocks your airways. So the symptoms of bronchitis are coughing, wheezing, and shortness of breath. The treatment for bronchitis includes antibiotics and reducing your exposure. And the factors for getting bronchitis a lot of times are smoking and even your choice of occupation, whether you're around air pollution, you're around smoke, everything else like that. And of course, environmental factors would be general air pollution, asbestos again, and then secondhand smokes, like especially if you have a parent, a grandparent that smokes and you are around them. Next, we have emphysema. And emphysema is a disease that progressively destroys the walls of the alveoli. And emphysema is, of course, most always commonly caused by cigarette smoke. The symptoms include very difficult breathing and chronic cough that's going to get worse and worse so the person is dependent on oxygen. The behavioral factors for emphysema are smoking and, of course, obviously their choice of occupation. And then environmental factors would be pollution, asbestos, and secondhand smoke again, just like bronchitis. So, of course, that's the end of the PowerPoint going over the chronic diseases. Next, you have this chronic diseases chart where I'm just going to show it to you what it looks like because it pretty much takes the PowerPoint that I just went over with you and breaks it down in just two pieces of paper so that you can see a faster version of it and see the high points of it. So that is there for you to look at any time. And then the last thing I'm going to go over is this website that was linked to the page as well. Of course, that's the CDC Disease and Condition Resource Library. And this is going to give you, of course, so many examples of the most common diseases and conditions. As you can see, it goes these are the most searched diseases, so these are more common a lot of times than anything else, but you have this whole list from A to Z to look up multiple different viruses. And you're going to need this website for the assignment that it goes with this objective, because you're going to be doing a PowerPoint on a chronic disease, and you're going to pick one chronic disease. Like I said, the disease pick a disease of your choice, and then you will explore it. And of course, there is another video in the assignment page that explains how to do this assignment that goes with it.